Hello, everyone. Thank you for joining the session. We'll just give it a few minutes so that people can join.
I can see Simon there. Simon Luck. Hi, Simon. And Joanne. Probably take a couple minutes to get them all on board.
Yeah.
Manuela, Tara. You can do a song and dance while we're waiting, can't you, Brian? I've heard some rumors about you and Christmas parties.
Yeah, I don't think anyone wants to see or hear that.
It was only a rumor.
In the meantime, let me change the chat so everyone can talk to each other.
Yeah. So while we're waiting for other people to arrive, the thing is, please ask questions. That's what we're here for tonight. So don't have to sit there and say nothing.
Yep, and I've just opened up the chat box so everyone can chat with everyone else.
Excellent.
Will we give it a few more minutes, Tony?
Oh, let's get started.
All right. Okay, Tony, do you want to take it over, please?
Shall do. Perfect. Good evening, everybody. I'm just going to pull up a PowerPoint. It's going to be sensible. If I do a share screen and I pull up that one there. And get into that mode. Good. So tonight's just an introduction and hopefully lots and lots of questions about what the skin cancer programs are at University of Queensland. By the fact that you're here in the first place implies that you've heard something about them. We basically have it's a postgraduate program, so it's not designed for medical students. Obviously, it's those who have already got some sort of degree in health. And there's, in amongst the different options, there's 3 programs. There's a Master of Medicine, there's a graduate certificate, and there's a shorter form credentials. Yes, we are recording it, Simon. It's a good thing, so it'll be available later on if you need to. It's quite okay. Yes, that's our 3 programs. The terminology is difficult in university. So a program is the entire master or the entire grad cert or the entire shorter form. Then we talk about courses, and courses is effectively a subject. So we do, in the Master of Medicine, you do 8 courses, which are worth 2 units each. You get 16 units of study, which counts towards a master's, is what we're talking about tonight. Now, obviously, as we always do, we have to acknowledge country. I'm from Burrarong country, where I'm talking to you from here. So I'm actually in Melbourne. And of course, the University of Queensland acknowledges traditional owners in the custodianship of the lands which we meet. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connection to the country. We recognise their valuable contribution to Australia and global society. So, universities are big places. You take an aerial view over the campus there in St Lucia, and it's easy to get lost. And that's part of what we're here for tonight, just to try to help explain how the whole system works as it's relevant to you and why it has to work certain ways as well. For us, we're not a matter of going to campus. We do everything online. So all of the programs, whether you're doing a grad cert or a master's or even the shorter form credential, there's an online program designed to be at your own pace to a fair degree, in terms of you don't have to be at a particular place at a particular point in time. There are some lectures, obviously, which are live, but majority is sort of meant to be, you can do things in the semester of 13 weeks at the time you want to. You're not coming out onto campus. So it is designed for people who want to can be doing it over in Ireland or in Florida or Buenos Aires is the idea too. That's our way we've approached it. So one common question we get asked about regarding the UQ programs is, well, how does that differ to other skin cancer programs I can do? Lots of other people offering education in skin cancer. And the way I describe that is we offer academic education rather than vocational training. So vocational training is very much, this is how you do this particular task. While an academic education is broader. And so you get a depth of understanding of why you do certain things certain ways and when you should consider other options rather than do step one, then step two, then step three. That's probably the best way to describe it. The second way of describing that difference is the volume of study. So as a guide for you, one course or one subject in the Master of Medicine or the Grad Cert over a 13-week period is roughly 130 hours. It's expected it'll take you about 10 hours per week per subject as amount of study. So 130 hours for one subject. If you compare that to a weekend course where it might be 15 hours of study, there's your difference. You've got 10 times the knowledge compared to a weekend course. And that's just one subject out of the Masters, one course out of the Masters, and you do 8 of those. I think that's a nice way of defining it in terms of the volume of hours. Obviously, you receive a formal university qualification, which is met with the Australian Qualifications Framework. So there is a formal rules and structure about what can be awarded at different levels. So a PhD is your highest sort of award that a university can give you for study. And then a master's is the second highest down. And that's sort of level 9, level 8. And as you go down, grade certain things, the equivalent certificates can be awarded outside of uni structure as like a level 4 or level 5. So it's certainly recognised as a higher level of learning compared to what other courses can offer you. Does anyone have questions about how that structure of it works? I'll keep on moving as people think about questions, of course. So that's what I covered there. Program is the whole of the education you enrolled in. The course is each subject that you do. Masters being 16 units or 8 subjects. And the grade cert being 8 units or 4 subjects. Now, we all do it part-time. We're expecting that you are otherwise working and seeing patients and doing things health-related and hopefully some skin-related things amongst that, of course. And so we're not expecting people to be doing this as a full-time course. So in theory, you could do 4 subjects in one semester, 40 hours study, and 4 subjects or 4 courses the second semester, and we finish a Master of Medicine in a year. Nobody does that, okay? At the most, people do 2 subjects or 2 courses, therefore 4 units in one semester. They might get through 4 different courses in a year, and therefore, at the best, people finish the Master of Medicine in 2 years. So don't be concerned about, this is not a race. This is a gradually enhancing your knowledge, gradually enhancing your learning. It's nice to get to the end of it, but it is a long, drawn-out process intentionally, because as you're learning these things, you get to engage them in your practice, enhance your practice as a consequence, keep on learning, testing things out. Then you learn some more things on top of it as well, is the idea. Yeah, so the types of subjects that happen. So for a Master of Medicine, you've got to be a medical practitioner because some of the subjects actually require you to submit surgical cases of your own. Obviously, if you're not legally allowed to cut somebody open, it wouldn't be very appropriate to ask you to submit that as your own surgical case. So that's our main reason for being a medical practitioner qualification. And that's why we do have the graduate certificate, so that melanographers, nurse practitioners, other healthcare workers who aren't medical practitioners or aren't registered medical practitioners can do a graduate certificate and get the same types of knowledge, but not have to have any direct patient involvement. So the first course and the first 2 courses everyone will do is what's called IMED 7001. You can see there on the left-hand side of the screen. And that's our core knowledge and professional practice. That's our introduction subject, and you cover a lot. But it's not just a simple overview. It's obviously quite in-depth, 130 hours worth of study, but it's a general overview of everything to do with skin cancer, mainly focused on the diagnostic side of it. but touches a little bit into therapeutics as well. And the second subject, which everyone starts with, is this clinical dermatoscopic diagnosis in skin cancer practice. This is mainly a dermoscopy subject. It's a diagnosis subject with a strong emphasis on dermoscopy. And again, you can do a weekend course in dermoscopy and you'll learn a certain amount over 4 or 8 or 15 hours, or 130 hours of study in dermoscopy, and obviously your depth of knowledge is going to be far greater for obvious reasons. It's just the time and the volume required. So that's the first two subjects that people start with. We then have a foundation therapeutics, and that's basically our introduction to all aspects of how to treat things. So it's topical and non-topical. So surgical, non-surgical, goes into radiotherapy and other sort of parts of medicine as well. It's not a matter of how to use a knife and cut an ellipse, not just about cryotherapy, but looking at some of the topical therapeutics as well. And again, with a fair breadth of knowledge in that regard. So it's important that we get an understanding of not just you put on F-Udix twice a day for 3 weeks, but how it works, why it works, what to look out for, what are the rare complications, how to manage those things, that sort of depth of knowledge. And the final of those starting subjects for the Master of Medicine is this assessment of diagnosis. And that's a lot of case studies, and that's sort of like a capstone type subject. It rounds off the other 3 courses, and that allows you to put your new knowledge to test on actual cases. And that's one really nice part about the Masters, is a lot of case study type work in it. So it's not just a matter of read a textbook, but now that you've read this stuff, let's put it into practical examples. You know, if you had this sort of person coming in the door, what would you be doing? And you've got little courses, little cases to work through with the group in that regard as well. A grade cert, in contrast, you're going to have undergraduate degree in health. So again, a medical student can't enroll because they haven't completed an undergraduate degree at that stage. And it should be in a health-related subject. So someone can't start with a Bachelor of Music and then go into a grad cert in medicine. But again, this is those who aren't medical practitioners but are in a health-related field of work, letting them have a good access to this sort of knowledge about skin cancer as well. Same subjects as you see there on the left-hand side. We start with core knowledge and we do the dermoscopy subjects. So everyone's doing the same first 2 subjects. Subjects 3 and 4 are also part of that. And a 5th one called 7016, Advanced Diagnostic and Professional Practice, is poorly named, to tell you the truth. It's actually a mixture of photography and genetics, is the best way to describe that subject. So half of it is looking at all the different imaging systems, different aspects of how to use confocal microscopes or photographs or 2D imaging or 3D imaging, and all the different systems around in photography of lesions, and using that for diagnostic purposes. And the other half is looking at all the genetics of skin cancer and how that all works, and when it's relevant in a clinical setting. So again, the focus is always clinical rather than esoteric sort of stuff. Yeah, so 13 weeks for each semester, allow 10 hours per course per week. About half the subjects have a end of semester examination, and there's a formal university exam period. Now, obviously, most university courses, people tend to sort of do 9 to 5, Monday to Friday. We're the complete reverse. We understand that most people are working 9 to 5, Monday to Friday, and they want to do their study after hours and weekends. And the course coordinators, people teaching you the subjects, are the same. They're practicing doctors. They're doing this day to day. And so they also do most of this after hours and weekends. So most times the exams end up being on a weekend rather than having to cancel some of your patients, is the idea too. That's to a degree by negotiation. So at the start of each semester, we tend to say, okay, we're thinking of these dates for the exams. This fits into the university calendar. This is the period we're allowed to have the exams. What suits people best? And then we negotiate and work that as we go through the semester. So some of the individual courses is where we need to get to next. I'm going to stop sharing there and just first of all check, is there any questions that people wanted to ask? I'm not seeing anything in chat at the moment, apart from Simon's original comment. Good. So let's go through some of those individual courses. The first one being, so they all start with this title IMED, IMED, then it's 4 numbers after it. It's 7001, 7002, etc., things like that. So IMED 7001 is that first course, and it's nicely divided into weekly tasks. So the first week might be just an introduction to skin cancer medicine and include some history. So you get a feel for where the field has evolved from. And there still is, 10-hour study just in that. In 7002, then you might go into 2 or 3 weeks, which are really different things about dermoscopy. So the core knowledge about dermoscopy, the different types of dermoscopy, not as in-depth as the 13 weeks of 7002, but certainly making sure everyone's up to date and up to speed with the basics of dermoscopy is the next go-to. Then it starts looking at histopathology and how that correlates with dermoscopy. Then there's a bit more focus into diagnosis and lesions, and then the correlation between dermoscopy and lesions. So you can see how it sort of keeps on evolving on itself. And so that involves tasks each week. So there'll be a little quiz, and you get to read the details. It's relevant to the topic of the week. You submit your answers, and those answers get discussed in a weekly online seminar. So Prof. Cliff Rosendahl runs that, runs it very, very efficiently and effectively. It's a busy subject, but it gets you in the right mood and the mindset of what's required in terms of the volume of study. And it helps you dip in frequently. So you can log in at any time and look at the cases, but you've got set times where things are due for assessment. And then lots of interaction with the discussion board with your colleagues to understand different parts of each course. IMED 7002, that dermoscopy course, again goes through different algorithms, different aspects of dermoscopy, and then ties in with a whole lot of cases as well. So again, lots of practical knowledge, lots of case examples where you get to give your opinion of what you can see, what you think the diagnosis is as a consequence. That gets discussed and compared. That's part of the assessment of the whole course. And you really just get a lot of in-depth knowledge of how dermoscopy works. 10 will start with things like basics of biopsy. This is the therapeutics course, basics of cryotherapy, shaves, knot tying, suturing, and all the little tips and tricks around that. So it's very much looking at not so much per disease, but per technique. And then it goes into Ephidics, Aldara, photodynamic therapy, those non-surgical therapeutics, keratolytics, and when to use those types of things and what advantage they have. Again, you can imagine you can spend a whole week just learning about Ephidics, and 10 hours of knowledge on Ephidics seems like a lot, but it's still only just scratching the surface to really understand it. But you put that with some case examples and things like that, and you get to really feel comfortable and confident actually using it rather than having heard about it and think you know how to use it. That's often the big leap that people find is, I've heard of this, but I just don't quite yet feel confident to do it more than anything else. And Anne's course with the is the case studies, which is again 7003, where the case is presented, you get to discuss it on discussion board, you submit your answer, those answers get reviewed and discussed by Anne. There are lots of learning points for each individual case, and it's just, you just get immersed in it is the idea. You see lots and lots of interesting things, lots of nuances to consider, and just really builds up your practice as a consequence, because you've got these experiences where you can sort of put your new knowledge into practical cases. I teach one called Advanced Therapeutics, 7011. Advanced Therapeutics is taking that basic knowledge you learn from 710 and putting it per disease. So we'll start with melanoma and just looking at all aspects of treating melanoma from a therapeutic point of view rather than a diagnostic point of view. We'll look at actinic keratoses and look at all the options for treating actinic keratoses as a disease entity. Then we'll do the same for Bowman's disease, IEC, squamous cell carcinomas, and keratoacanthomas. So we take the second part of therapeutics as a per disease process rather than per treatment process. You can see how the two mix together. Again, lots of case studies. For my course, you submit your own surgical work and we look at each other's surgical work and give constructive feedback. It's a bit scary when you have to present your own work. But reality is people do very good surgical work, and it's nice to have the opportunity to be able to review what you're actually doing and having constructive feedback about, have you thought about this or thought about that? It's hard to get elsewhere, other people's opinion of your work, but it's not a hostile environment. That's important. We make sure that this is constructive rather than hostile. Now, in terms of level of surgical ability and skill, you don't have to be doing advanced flaps and complicated procedures. If you submit cases that are just simple ellipses, that's still adequate. You might learn more about other options as well, but you don't have to do those things until you feel confident doing them. Now, many people are at that sort of level where they're happy doing quite complicated surgery, and that's encouraged if you're comfortable doing that, but it's not compulsory is the important thing there. I've mentioned the genetics and the photography course. There's also another course of surgical cases called Advanced Clinical Cases, and that's the original course, or the first course you do is very much just diagnosis. The second series of cases are a level of complexity higher, and they include therapeutics. So you take the entire case from here's the person and here's the scenarios, here's the issues, what do you think it is? What are your differentials? How do you want to manage it? What's the options for management? What are the outcomes? What are you worried about? So they're relatively complex cases, but they are primary care cases. So the main focus of all of the UQ Masters is these are pretty much most things that can be done in a primary care setting. Now, obviously, we can't do radiotherapy in a primary care setting, so not everything is primary care, but the radiotherapy is more about knowing when to refer it out for radiotherapy and why, and what the patient experience might be, so you can do good quality referrals for radiotherapy, for example. We then have a couple of research subjects, and that's the other nice thing is as you get this body of knowledge and you've got interesting experiences, you start thinking of questions and you read around topics and you work out there's areas where the knowledge isn't complete. And especially in primary care, there's a limited amount of research compared to other specialties. It's just the nature of primary care. And we've got some research subjects, so you can pose a research question and you can prepare that question in a research manner to the stage of a literature review, which can be published, or to the stage of it presenting to an ethics committee so you start the project. So it's not completing an actual research project, but it's understanding the basic building blocks of how to do research and how to do it in a primary care setting. So not bench work, not squeezing pipettes and torturing mice or things like that. It's much more about keeping it clinical, but very practical and relevant to what we do in primary care. Final subject, 7014 is one which is a audit type subject. So the SCARD database, SCARD, is Skin Cancer Audit Research Database. So that SCARD database is one where you can collect your own personal data about the procedures and biopsies you're doing, and then you can have the opportunity to reflect on that and analyse your work over a period of time. And that's part of the assessment there. That's critically reviewing journal articles, so not just reading an article, but then being able to assess what's good and what's bad about the article, where there's some weaknesses, why there's gaps in it. So learning how to critically appraise things rather than just taking things verbatim. So there's that type of work in that subject where you get that, again, next level of depth of understanding of how these subjects work. I'm going to stop there for the moment in talking about the course. Is there any particular questions that people have? Good, Taryn. The question about the Skin Cancer College of Australasia. Yeah, good question. So we're two separate bodies. The University of Queensland and the Skin Cancer College are two separate entities. The Skin Cancer College recognises, I'll start the other way. If you do the advanced dermoscopy from the Skin Cancer College in their 6-month program, that's been approved as recognised prior learning for that one subject of the Masters, 7002. So we have recognised prior learning where someone's done an equivalent sort of level of study to one of the subjects, you can be granted recognised prior learning for a subject. So the 6-month course in dermoscopy from the college has been granted recognised prior learning. The entire master's program, the college recognises that as the education component towards fellowship. So I'm a fellow of the Skin Cancer College, and so my teaching and knowledge from running the master's program counted as my education, along with my dermatology training. But I still had to submit 45 surgical cases as part of the fellowship. That's separate to what we do in the Masters, but we do similar things. So in the subject for advanced therapeutics, you submit surgical cases. Those same 6 cases can be part of your collection of 45 cases for the Skin Cancer College Fellowship. The Skin Cancer College Fellowship has an OSCE exam at the very end of it. So once you've passed all the other components, you get invited along to sit an examination. And again, your knowledge base from the Masters makes it easy to pass that fellowship OSCE examination at the end. Question regarding medical degree from India, eligible for, yes, definitely. So there's an international system for recognition of medical degrees. And I don't know enough details about which ones may not be recognised, but in general, yes, and especially if you've become registered as a doctor in Australia, that's met all the criteria required for entering the University of Queensland course. For those who are living overseas and practicing as a medical practitioner, as a general answer, yes, but there is information available online regarding what level of qualification is required and what medical degrees are accepted. I'm not seeing any other questions there at the moment. Is there anything else you thought we should be covering, Brian?
Oh, I think another question, can you share a link to the information available? I can pop a link to Master of Medicine program.
Yeah, that'd be good. Perfect. So there's all of that's it. Perfect. So all of the courses of the university, whether you're doing engineering or arts, have a very similar format of here's what it is, here's what's required, and then it goes into different details about that. So you'll find all that information there, Parabi, about what's required. And then if you click on the I'd like to enroll process, that will then show you exactly what you have to submit to be able to enroll. Now, the process is that you apply to enroll in a program. So you choose to enroll, you request to enroll in a Master of Medicine, you request to enroll in a graduate certificate, and you fill out the application for that. And the assessment team at the university looks at your application and says, you've met the criteria and you get an offer to enroll. And you then have to accept the offer to enroll. So it sounds long-winded and complicated. These are university processes. So you apply, you receive an offer, and you accept the offer, and then you're in the program. Now you've got 10 years to complete a program. So if you do a subject, and then for some reason you have to stop for 4 or 5 years for different personal reasons, and you come back to it, you can continue the program, and the credit for that first subject you did is valid for 10 years. But if suddenly we get to the 12-year mark or the 13-year mark, it might still be acceptable, but it's got to be specifically applied for. So once you've applied, been offered, and then accepted, then you enroll in specific subjects, specific courses. So you enroll for the program, and then you choose which courses you want to do. We might leave it there then, shall we, Brian?
Yep, that sounds good. So just so everyone knows, the recording will be sent out tomorrow morning. Yep, I think the questions have stopped. So thank you everyone for joining us, and thank you, Tony, for all the information.
Yeah, thank you all. And obviously, if there's any other questions you have at a later time, please feel free to email us. We're happy to answer them, obviously. But if you go through that link that Brian put up there before, you can start, there's lots to read there, but you'll start working through the process of how to actually enroll in the program. So the next one starts at the end of February, is semester 1, but I'd start the process now because you've got to suddenly get your access to your transcript of being a doctor. So there's a bit of paperwork to collect and put together. So it's worth starting the process of enrollment now, even though the next semester doesn't start until end of February.
There's just one more question in there.
Yeah, enrollment request due by, I can't remember the final date of enrollment. It's about the start of February is the last dates to apply for the course. It's about 2 weeks before semester starts.
Yep.
Mainly for the process of receiving application, confirming it, presenting an offer, accepting the offer, enrolling in courses. That itself takes a week or two. So it's usually early February is the cutoff date for applying for a course. Once you've been accepted, you just choose the courses you want to do. It's usually in a couple of weeks you'll get an offer. So it's usually once you've actually completed the submission, it'll either be, sorry, we can't accept this because we're missing this information, or yes, here's your offer for it. Now, the admissions team, as you can well imagine, gets really, really busy in the last weeks of January because everyone leaves at the last minute. So it takes longer at that point in time. If you're applying for it now, they haven't got much to do at the moment, the admissions team. It's quite nice for them. They're relatively quiet. No age cutoff, Parabi. You can, as long as you're qualified as a medical practitioner, you can be 80 years of age and still do this program. In fact, one of my current students is 67, if that's any use to you. Excellent.
All right.
We shall leave it there, Brian.
Yep. Have a good evening, everyone, and thank you for joining us.
Thank you all very much. Looking
Bye.
forward to seeing you all online. Bye now.